Welcome to this explainer. Today, we're diving straight into a condition that affects literally millions of people worldwide, yet it is still incredibly misunderstood. We're talking about generalized anxiety disorder, or GAD. We are going to break down its exact clinical definition, the strict diagnostic criteria used by psychiatrists, and the science behind how it's treated.
Here is exactly how we're going to break this down today. We'll start by defining generalized anxiety disorder, then look at the core diagnostic criteria. From there, we'll cover physical and psychological symptoms, explore the root causes of GAD, and finally, discuss managing and treating the disorder.
All right, let's jump right into Section 1, defining generalized anxiety disorder. What exactly is GAD?
So if we look at standard psychiatry textbooks like the DSM-5-TR or Kaplan and Saddox, they define generalized anxiety disorder as a chronic anxiety condition characterized by excessive, persistent, and difficult-to-control worry about multiple areas of life. This isn't just about getting a little bit nervous before a big presentation or job interview. It's a chronic, heavy burden, and medical authorities recognize it as a very distinct and deeply impactful disorder that absolutely requires clinical attention.
And that brings us to this really fascinating clinical concept, persistent free-floating anxiety. So what does free-floating actually mean in a clinical sense? Well, it means the worry isn't tied down to one specific situation or a single phobia. Instead, this excessive anxiety just kind of hovers. It attaches itself to everyday matters, right? One day it might be your health, the next day it's your finances, the next day it's work. It's not limited to just one trigger, which is exactly why it is so completely exhausting for the person going through it.
Moving right along to Section 2, the core diagnostic criteria, also known as the clinical threshold.
Okay, the number 6 is literally everything here. Specifically, 6 months. In the psychiatric world, 6 months is that crucial dividing line between, say, a highly stressful period in your life, like moving across the country or starting a new job, and an actual chronic clinical disorder. If that excessive worry hasn't lasted for at least 6 straight months, well, then it doesn't meet the core feature requirement for GAD. The textbook clinical threshold requires excessive anxiety and worry occurring more days than not for at least 6 months. I really want you to focus on that phrase right there, more days than not. That means for the majority of the time, this person is trapped in a cycle of excessive anxiety. And again, it spans across multiple domains: work, health, family. It is just entirely pervasive.
Beyond just the time frame, there are a few other core diagnostic features we need to look at. First up, there's a profound difficulty controlling the worry. The person actively feels like they just cannot stop or manage their racing thoughts. And here's why this matters so much. It causes clinically significant distress, and it actively impairs their social or occupational functioning. Basically, the anxiety is literally getting in the way of their ability to do their job, keep up with friends, or just, live a normal daily life.
But before a doctor can actually finalize this diagnosis, they have to rule a few things out using some vital exclusionary criteria. On one hand, the symptoms must not be due to substances. So that means recreational drugs or even side effects from prescribed medications. On the other hand, the symptoms cannot be better explained by a totally different disorder, like panic disorder, OCD, or depression. This comparison step is absolutely vital, because doctors need to be 100% sure they are identifying and treating the actual root problem, not just a symptom of something else entirely.
Okay, let's head into Section 3, physical and psychological symptoms, the mind-body connection.
Now, this brings us to a genuinely surprising clinical fact regarding diagnostic requirements. For an adult to get a formal diagnosis, the requirement is that they must exhibit 3 or more associated symptoms. But for a child, only 1 symptom is required. 1. This is a huge acknowledgement that kids process, internalize, and express chronic anxiety completely differently than adults do. So psychiatrists adjust that clinical threshold to make sure children actually get the help they need.
So what exactly are these associated symptoms? Let's walk through them. There's restlessness, that constant, inescapable feeling of just being on edge. Then there's easy fatigability, meaning you get worn out super quickly because your brain and body are basically running a marathon all day. There's difficulty concentrating, or your mind just going totally blank. We also see severe irritability, deep muscle tension, and of course, sleep disturbance, like tossing and turning, unable to fall or stay asleep. I mean, just imagine the heavy weight of carrying 3 or more of those burdens around with you every single day.
And I really want to emphasize this next point. People with GAD are often clinically described as chronic worriers, but this disorder is not just in their heads.
These chronic worriers suffer from very real physical pain. The medical texts explicitly note they frequently experience physical symptoms like persistent headaches, muscle aches, and severe gastrointestinal discomfort. The brain and the gut, the mind and the muscles, they are entirely 100% linked in this disorder.
That brings us to Section 4, the root causes of GAD, a multifactorial etiology.
The etiology, or the root cause of GAD, is what we call multifactorial. Basically, that just means there's no single switch that flips in the brain to cause it. If we look at the biological category, we see it can be driven by a neurotransmitter imbalance, specifically involving GABA and serotonin in the brain. Then there's the genetic piece. Having a family history of anxiety disorders heavily increases your risk. Moving down to psychological factors, we're talking about deeply ingrained cognitive distortions or a severe intolerance of uncertainty. And finally, environmental factors. Things like experiencing highly stressful life events or prolonged chronic stress. Any or all of these distinct categories can intersect and compound to create this disorder.
Finally, let's pivot to Section 5, Managing and Treating GAD, the path forward.
When it comes to treatment, medical professionals usually guide patients through a structured three-step plan. Step 1 is psychotherapy, specifically cognitive behavioral therapy, or CBT, which is considered the absolute first-line defense here. It helps patients rewire those cognitive distortions we were just talking about. Step 2 involves medications. Doctors will often prescribe SSRIs like sertraline or SNRIs, and sometimes even short-term benzodiazepines to help manage the really acute symptoms. And then Step 3 focuses on lifestyle adjustments. These are so critical for long-term management. We're talking improving sleep hygiene, actively practicing stress management, and utilizing relaxation training. Put all these together, and they form a really robust, effective shield against the anxiety.
All right, to truly cement your understanding of this explainer, I want you to remember these 4 key textbook takeaways. First, the duration. Excessive worry lasting 6 months or more is absolutely essential for a clinical diagnosis. Second, the worry is truly generalized. It's free-floating, not tied to one specific situation. Third, the physical and psychological symptoms coexist heavily. It is a complete mind-body experience. And fourth, while it is a chronic condition, it is also a highly, highly treatable one.
We have covered a massive amount of clinical ground today, guys, but mastery requires going just a bit deeper. So I'm going to leave you with this question directly from our sources to guide your next steps. What would help you most right now? Do you need to test yourself with a quick exam answer layout? Do you need a solid mnemonic to lock in these diagnostic criteria? Or would a deep dive comparison with panic disorder help connect the dots for you? Pick one, keep that curiosity alive, and keep learning. Thanks so much for joining me on this explainer.